Hey everyone, Julie Heath here. This video is going to go over concept maps. I know that I have a couple videos that I've already done regarding concept maps, but I've learned a few things since then. And so I'm going to update it and hopefully make it shorter. So hang in there with me. If you are new to concept maps, then this video is really for you. I'm hoping to help you figure out where to go, what to do, and help you to kind of get an idea of what concept maps are and how to formulate them yourself. Okay, I'm going to go ahead and share my screen. All right, so this is a concept map. This is one of the templates. So there are different sections to a concept map. This is the alternative template, and I'll show you where to go to find that in a moment. This is going to be a Word document, and you fill out the different sections, and then the concept map itself is down below. You would list your concept, your main concept here or here, S bar, Q, signs and symptoms. Anyway, so as you can see, you can go through it. We'll go through it in just a second. Anyway, so this is an example of the alternative concept map. I'm going to show you where to find that now. So first things first, I'm in my Canvas dashboard, and the alternative concept map is found in the ELO, which is the Experiential Learning Orientation module. You open that up and scroll down to Tips, Success, and EL. Down below is where it says Concept Map. Read all of this information. All of this is very important information. It talks about what a concept map is, why it's important, late policy, that kind of stuff. If you have previously done a HESI exam, then you may be able to find a concept based on your HESI dashboard. If you have not had a HESI exam yet, don't worry about that. You can find it, and I'll show you how I normally find mine. This is the concept map example, which I have up. This is the other format of concept map. This is the original format. Sorry, I went up too far. This is the original format. This is a PDF document, and it, in my opinion, is harder to manipulate than the Word document. So I typically use the alternative format, but this is the example. So this is where you go to find the example, is in the ELO concept map example. Keep that in mind because you will need to use this as like a side-by-side so you can make sure you're doing it right. Okay. So concept map example, it also has S-bar tips. So that's really important so that you know exactly what they need in the S-bar and how to word it, because your words mean a lot in that section. How you word things are very important. Okay. And then this helpful tips to complete the concept map is a video, and I highly, highly recommend that you go and watch that video because it is very helpful in how to formulate your concept and your patient and your what you're going to put in the concept map. It goes through each box, each thing. It's very, very helpful. So if you learn nothing else from this video, go to this section under concept maps in the ELO and watch this video. Okay. And then how to manipulate the concept map template. That's talking about this version of it, the original version, the PDF version. So how to manipulate it. Okay. And then some other helpful information as well. Okay. So that information is very good to know. Keep that in mind. Okay. So first things first, you're going to go to your, I'm going to put that, let's see. Let's go Canvas. Okay. First, you're going to go to your main nursing course. Okay. This is the only course that you're going to have concept maps in, is your main nursing course. So if you're not in a nursing course just yet, this is good information for you to have to kind of put in your pocket for later use. But you will not have a concept map until you are in a nursing course. I'm currently in BSN 366. I've had several concept maps. I've not always been successful. Mostly at the beginning, I did not do well. And so that's why I started figuring out how to improve. And I made a video a couple semesters ago. If you watched that one, awesome. I hope it was helpful. This one's just to update that and hopefully make it shorter. So go into your nursing course, okay? And they used to have a resources link up here. They don't do that. They don't have that anymore. So just go into week 1 or modules on the side, either way. And then you can scroll up. So there's 2 things up here that I want to focus on. The very first thing is the concept maps assignments area, okay? It does have a concept map assignment guide, which will definitely help to show you where to go, how to get the different things, what you're looking for. But it does say in there that you should look in your HESI dashboard, which can be confusing if you don't have one yet, or if you haven't had a HESI. So in that case, you would use your textbook. This is where you're going to be turning in your concept maps when you're done. So concept map assignment number 1, I'm going to go ahead and click on that because I haven't turned it in yet. It's due tomorrow and I will do it today. And this is the rubric. It also has a concept map assignment worksheet that you can download, which is going to be this one. Okay. Not that one, this one. Oh, yeah, this one. So just close out of that. Shoot. Where did I go? Well, I'm just going to go right back. Concept map assignment. Anyway, okay. So this is going to be the rubric. The things I would closely follow, okay? Follow the rubric to a T, okay? They are looking for very specific things. Follow the rubric. If you have questions about the rubric, reach out to your EL instructor, or you can reach out to your professor, but they'll probably refer you to your EL evaluator. You can email your EL evaluator at whatever number course you're in. For example, I'm 366, evaluator at nightingale.edu. So if you're in 225, it would be 225 evaluator at nightingale.edu. 366 evaluator at nightingale.edu. So email your evaluator, ask the questions you have regarding the rubric. Hopefully you're doing this a lot in advance, because they may or may not get back to you in time for it to be turned in. So please make sure you're giving yourself enough time to ask questions. Okay. So concept map assignment worksheet, you can work on that, or you can go to the ELO and get the alternate concept map and download that. Follow the rubric, okay? And then also follow the example. You want to look at the example and follow it as closely as you can, okay? Obviously don't copy it, but follow how they're saying things, how they're wording things. You want to follow it as closely as you can, okay? All right, so how do we find a concept? So first things you want to do is go to, if you don't have a HESI dashboard, go to the modules, and you're going to find your book. That's not the modules. I was in the wrong thing. You want to go to your core nursing course, so BSN 366 for me, and go to week 1 or the modules in the course, and you're going to scroll up to the resources, okay? These are all the resources that you have. Your course ebooks are going to be listed, and you're looking for Concepts for Nursing Practice, 4th edition. Okay. I already have it open, so I'm not going to open it again. Okay. So in this book, it gives every concept. Okay. If you're wondering what is a concept that they're looking for, these are all the concepts that they're looking for. Okay. It has all of them. So what you do is you pick one of these concepts as your main concept. So for example, they decided to go with inflammation. Let me see if I can try to find that. Inflammation. Okay. So they're going with inflammation for their concept. I'm going to show you here. See? Main concept, inflammation. Their patient that they've chosen is a 5-year-old boy with apparent acute severe exacerbation of asthma. Okay, now up above in this first box, you're going to list vitals, what the main issues are, a medical history, the most important and relevant information for this patient. Okay. Then you're going to go on to analysis. What do these cues mean? What does the signs and symptoms that this patient is experiencing? What does it mean? What could possibly be the diagnosis and why? So that's kind of what they're looking for here. You're analyzing the cues. Analysis is, so you want to explain the most likely scenario. So the most likely thing for this patient is that he's having an asthma attack or an exacerbation of asthma. And you want to kind of explain that. What's the most serious explanation? What's the priority order for safe and effective care? So you want to, the most serious explanation at this time would be a severe asthma attack affect the client's ability to breathe, the priority for safe and effective care. And when I say use the wording that they want you to use. So make sure that you're putting it in the same type of terms that they're using. Not exactly, but the same type how they're professionally listing it. You need to use that type of professionalism in your writing as well. So the priority for safe and effective care for this client would include maintaining patent airways and an adequate oxygen saturation level. So those are the things you're looking for, right? Okay, then in the next section, planning, you're generating solutions. What does that mean? Okay, so you're going to be planning. It's like your care plan for the patient, basically. So what are you going to be doing for this patient in order to achieve those? So you're setting SMART goals. So SMART is specific, measurable, attainable, realistic or relevant, and time-restricted goal setting, okay? That's your SMART goals. You want to make sure that you're listing statistics, you're listing the percentages or the exact blood pressure or an average that you want to be achieving, your goals that you want to be achieving. You want to list those here, okay? You want to list your main goals that you want to achieve here, and then implementation. How are we going to achieve those goals? So what can you be doing in order to achieve those goals? So here, pay attention really, really good to this part, because a lot of people miss on planning on their SMART goals because they're not in SMART format. They also miss on taking actions. So how you're going to achieve the SMART goals is what are you going to do? So for example, how should the intervention or combination of interventions be performed, requested, communicated, taught? Those are very important words here. Okay, that's what they're looking for here. So what are you going to be implementing? Well, positioning the client is very important. That's doing. You're doing something to help them breathe better. Okay. Or a semi-Fowler can help with dyspnea. And so you want to put what you're doing and why you're doing it. Offer the client water to help thin secretions and hydrate some clients, and then the why. And then the client and caregiver education. Education is such an important piece in every single diagnosis. So there should be at least one point where you put an education piece. Okay. And then therapeutic communication, since this is a pediatric client, earning his trust can be taught, but can be tough, but very important so that he feels safe. So, just explain what that means and why you're doing it. And then offer to turn on a movie or music to keep him calm. Okay. And then at the very end, it's going to be an evaluation. So at this point, you're looking at, okay, you've already come up with a plan. You've come up with goals that you want to reach for this patient. You've done your interventions, how you're going to reach those goals. And now you're sitting back and you're looking at them and you're saying, okay, were these goals effective? So in this section, what you want to do is list basically what you did, and you want to list if it's effective or not. It's okay if something that you list is not effective, because as long as you say this was not effective and this is why it wasn't effective, okay? Because that shows you're reevaluating the situation, and that's exactly what they want to see. They want to see your critical thinking, okay? Okay, so then you have your main concept, you have your patient information, which is your SBAR. You have your disease process, your pathophysiology, your risk factors. That part is going to be found in you can find that in a lot of different places. You can go look up articles online. You can look up the Davis Drug Guide. You can look up, as long as you are citing your sources, you need to have this filled out extremely well, okay? So the main place that I go to get my information is from, let's see, I'm going to go back to my dashboard, and I'm going to go to, let's see, it's not listed here. I'll go back into my main class, and on the left-hand side, you're going to find the library, okay? So where I go to get my pathophysiology is the library. The library is very, very helpful. Oh man, sorry. I haven't logged in a little bit. Okay. So you want to click here to launch EBSCO. So don't go looking at all the other things right now. This is where you want to go. You want to launch EBSCO. And then I scroll down to databases. And then I'm looking for dynamic health. Okay, that's where I go. Dynamic health is where I like to go to get information, disease conditions. This is something that you can cite easily, and it gives you a lot of information. So you can go to disease conditions, and I'm just going to go to A, and I'll look for asthma, or you can type it in. Asthma. And in this case, in their example, they gave an adolescent. So I'm going to go asthma adolescent. Okay. This is where I can gather all of my pathophysiology information. It gives you an etiology, pathophysiology section where you can kind of paraphrase and make sure you're citing your information, of course. But you can get good information from here. It also gives you risk factors, which you have to be putting as well, and common signs and symptoms, and all of that, diagnostic lab tests that you should perform, imaging, all of that information, and treatment considerations. So personally, this is my favorite to go to, because it gives you a lot of great information that you can use in your concept map. Okay. So, and that's going to go in your disease process, physiology, pathophysiology, risk factors section. You want to list a lot of those things here. Okay. Okay. So I'm going to go back here for a second. So you have your main concept, which they've decided to choose inflammation. as their example concept. And then they're going to put their S-bar here. Go back and look at the S-bar tips page on the ELO. That's very, very helpful information if you're not sure what an S-bar is or how to go about listing it. That's very good information for you, and it will definitely help. And like I said, go along with kind of what they said, have listed here. Just kind of mimic it and give really good information. Be specific in some areas like this. Like if your patient has a fever of 100.4 degrees Fahrenheit, list exact numbers, okay? And then you're going to go on to the disease process, listing your pathophys, your a lot of information about that, the risk factors, maybe even treatment options and things like that for this disease process. And then you're going to go to recognizing cues, which are the signs and symptoms. Now here you're going to list the main and most important signs and symptoms that are associated with the concept and the pathophys, the disease process that you chose. So you want to make sure that it's relevant to this disease process, not just anything that they're experiencing. So say, for example, your patient has a stab wound, but they're also a smoker, and you're not going to be focusing on emphysema. You're going to be, you're going to be focusing on bleeding. You know what I mean? Like, make sure that it's relevant to what your focus is my point, I guess. That your patient could have a whole lot of underlying conditions, but make sure that the disease process that you've chosen is what you're referring to in this section and throughout your concept map. Okay. So that it's cohesive and not confusing. You don't want to be going back and forth between different ideas. You want to focus on the main idea and what your goals are for that one disease process. Okay. So recognizing cues, you're going to be listing your signs and symptoms, like I said, and then you're going to be analyzing those cues like you have above up here, and analyzing cues. This section, what you came up with here, you can list down here. Just you need to be a little bit more detailed and more organized, and you need to list probably at least 4 things that you're going to be looking at as possible, like the signs and symptoms and why the patient is having those signs and symptoms. Okay. So for this patient, it's wheezing indicates bronchial inflammation causing airway constriction. So they've done a really good job of incorporating not only asthma, but the inflammation aspect of it too, which is what their main concept is. And then dyspnea, shortness of breath, causes tachypnea and tachycardia. And then hypoxia, or low oxygen saturation, is related to the impaired gas exchange due to the airway constriction. Now, this is what, I don't know if I mentioned this before or not, but there are interrelated concepts, which your book has. I'm going to go show you that really quick. Inflammation, I'm going to scroll down so that you can see there are bubbles and gold bubbles or whatever that every single chapter has, and it's interrelated concepts. So say, for example, they chose inflammation, but this also has to do with gas exchange too, right? So you could have chosen gas exchange as the main concept for this, for asthma, because it does impede gas exchange as well. So all of these are interrelated concepts having to do with inflammation, but gas exchange can also have the interrelated concept of inflammation as well, right? Okay, so you want to keep that in mind. So you could have done inflammation or gas exchange or, whatever else. And then fever related to suspected respiratory infection. So they did a really good job on looking at the signs and symptoms here and taking the most important signs and symptoms and explaining them here. Okay. And then you're going to take these, like you're kind of narrowing it down a little bit, right? You want to take these and you're taking it over to prioritizing hypotheses. Out of these, which one is the most important thing that you're going to be addressing first? Okay. This is where critical thinking comes into play, where you have to address the most important thing first. And you also have to think of, if I were to address this, then it would also take care of this. You know what I mean? So if you're addressing the wheezing and dyspnea, it may help take care of a couple other things like shortness of breath, tachycardia, tachypnea. So it may take care of those things. So we're not listing those as things that we're necessarily going to be focusing on. We're going to be focusing on the other things, because if we take care of the wheezing and dyspnea, then it's going to take care of the tachypnea and the tachycardia. Does that make sense? So the prioritized client conditions and care are listing 3. I think it says list 3 to 5, if I'm not mistaken, in the rubric. This is where the rubric comes in very handy, because you want to make sure that you're listing enough items in each box. So wheezing and dyspnea is the most important, followed by hypoxia, and then the fever. Okay. So here you want to think ABCs as well. If they don't have a patent airway, they're not getting air in, it's going to cause hypoxia, but we also want to keep hypoxia in mind, because we want them to be above 95%. And then the fever is last, because obviously that's not going, if they don't have an airway, their fever is not going to matter one way or the other. So we have to focus on the airway first, right? So keep that in mind. So critical thinking. Then we're going to go to the SMART planning. So this section, take a look at how they word it. Take a look at what they're wanting to include and what their goals are. Okay. So for example, within 30 minutes time of breathing treatment, that's they're being specific, and application of supplemental oxygen via nasal cannula, so specific and relevant. The client will obtain and maintain oxygen saturation levels above 95%. So they want those very specific, measurable. Measurable is the 95% part, okay? And attainable within 30 minutes of the breathing treatment. Is that realistic? It may be. It depends on the situation, but it may not be. You can put within an hour, but hopefully within 30 minutes, it's your breathing treatment is working effectively. So you can put within 30 minutes to an hour, but you want to be specific though as well in this, okay? So use those measurable stats and figures so that they can check that one off. So you don't miss out points because you're not being specific and you're not hitting all of the things. Okay. Another one is within 30 minutes of breathing treatment, respiratory rate will be within 20 to 30 beats per minute, and heart rate will be within 75 to 100. 115 beats per minute. I was like, wait a second, respiratory rate. That is still a bit fast, but let's see, what was their respiratory rate up here? 40 breaths per minute. That's very fast. So even though it's a little boy and he's 5 years old, 40 breaths per minute is still fast. So we want it to slow down to their goal within 30 minutes is to get his breathing a little bit more under control. So within 30 minutes, we want his respiratory rate to slow down a little bit a little bit more to be within 20 to 30 breaths per minute. And his heart rate will be within 75 to 115 beats per minute. And right now it's 130 beats per minute. So these are, it's kind of a combination goal, but that is a very good, they're related. So that's a good thing to have as well. Okay. And they're very specific. It's attainable. It's measurable because they have these parameters here. So make sure you're putting those parameters within your goal as well. Okay. I'm not going to go over the rest of them. You can read it yourself, but please try to mimic or at least go along with how they're wording things and because this is exactly what they're wanting to see, how it's going to be worded and what your goals are in this case. Okay. And then take action. How are you going to implement these 5 things? Okay. You want this these 5 things to be reflected over here, the same 5 things, okay? This is not going to be different. You're not going to take action on 5 different things. You're going to be doing the same things. You're going to go off of what you just listed, okay? So number 1 should reflect number 1 over here. So within 30 minutes of breathing treatment and application of the supplemental oxygen via nasal cannula, the client will obtain and maintain oxygen saturations levels at greater than 95%. How am I going to implement that? Okay, so the number 1 should reflect what you do to attain this goal. So I'm going to apply the nasal cannula and titrate the oxygen to maintain the oxygen saturation above 95%. Great, perfect. Okay, number 2, within 30 minutes of breathing treatment and respiratory rate, the respiratory rate will be within 20 to 30 beats per minute, breaths per minute, and the heart rate will be within 75 to 115 beats per minute. Okay, how am I going to attain that? So number 2 over here is going to say, I'm going to administer medications, breathing treatments as directed to decrease the inflammation and wheezing, listen to the lungs every 30 minutes, times every 2 hours to assess for wheezing. Okay. Assessments are great, but it's not an intervention by itself. Okay. You're going to be assessing the patient constantly, but you don't just put, I'm going to monitor the patient every 2 hours. You have to do something in order for things to change, right? So what are you doing in order for it to change? So you're administering medications and breathing treatments, and that's what you're doing in order for their stats to change, okay? So keep that in mind. So number 3, I'm just going to go through real quick. Client will have improved airway clearance related to repositioning as evidenced by clear lung sounds in all 4 lung fields anteriorly and posteriorly by the end of the shift. Okay, how am I going to achieve that? Number 3 over here should reflect over here. So number 3, I'm going to position the client in a high Fowler's or semi-Fowler's position to maintain the airway clearance. That's great. Changing the patient's position is doing something. You're making a change. So that's reflecting your goal over here, and this is how you're going to achieve it. Okay. I'm not going to go through the rest. Okay. Finally, after you've done all of that, you're going to get to evaluating outcomes. At the very end, you're going to look at all 5 things that you have listed up here. All 5 of these things, you should be doing the same thing. Number 1 up here and up here should reflect right here. So you're going to look at number 1. You listed your goal, your SMART goal. Number 1 over here in taking action, you listed what you're going to do to achieve your SMART goal. And then down here, we're evaluating that SMART goal. Okay. So we're going to say number 1, the client's O2 saturation was 98% on room air without evidence of dyspnea or chest tightness following oxygen therapy. So you can either list it just like that, or you can even improve it by saying this shows signs of improvement from, what was it before? 90%, I think. Yeah. His O2 sat was 90% when he came in, right? So it shows signs of improvement at 98% on room air without anything, without evidence of dyspnea or chest tightness. Okay. So that's a really good show signs of improvement. Number 2 should also reflect number 2 here and number 2 here. Okay. So, and so on and so forth. Okay. I'm not going to go over all of it, but do you understand? So it should correlate to what you did before that. This information up here, you're kind of formulating. All of this up here is information. It's incredibly important to formulate your patient, their diagnoses, and to get your brain around what's going on with this patient. And then down below is where you're explaining what's happening. You're giving your S-bar. Here, do not be long-winded. Here in this section, your S-bar needs to be short, sweet, and to the point. Okay. Relevant to this patient in this moment, not 5 years ago, We don't want to go history, family history. We're not going down that road. We're just focusing on right now, what's going on with this patient right now. And then it should be reflected throughout the entire concept map. Okay. And then after you've completed your concept map, you want to go through and make sure that you are citing your sources. You make sure that you are listing them down below, because you do have to have a reference page added if you use references. And in my opinion, you should use references, especially, especially in the disease process pathophys section, because you ain't coming up with this stuff on your own. So where are you getting it from? So you should have sites, in-text citations here, and your references listed down below. If you need APA help, you can go to the library as well. They have a lot of different resources there to help with APA formatting. And I think that is it. So after you are done completing, listing out, putting in all of your information in the concept map, and really quick, where did it go? I'm going to go back to, I think I X'd out of it. Back to the ELO, and I'm going to go concept map. I'm going to do the alternate concept map template. Okay. So this concept map right here, the original format, this is a PDF document. Okay. If you go to this one, you are doing the exact same thing. You're just listing it, putting all of this vitals signs information, and you would be putting it under here. Okay. So same boxes, just different format. Okay. So please don't get confused by that. Okay. And then, like I said, you're doing your S bar here, your main concept, 1 word, 2 words, gas exchange, inflammation, whatever is going to go here. Not the diagnosis, just the concept. Okay. And then so on and so forth. And then you can list all of the information here. In my opinion, this one is easier to manipulate, easier to use. That's just me. The other one looks fancier, but it ends up being a pain in the butt for me. So I like using this one. Okay, once you are done with all of that, you're going to go to your back to your concept area in your courses. So BSN 366, and I'm going to go to modules, and I'm going to go to concept map assignment number 1. Okay, this is where you will take the rubric and you take your concept map. Say, for example, I finished my concept map. I'm going to go back and forth between the rubric and my concept map, and I'm going to make sure that I have all of the sections filled out according to according to the rubric, because you want to get as many points as you can. Now, let me just tell you this. If, for example, in your, I'm going to go to the bottom because this is where it is, nursing process template, okay? This is the overall, okay? This is is it completed? Is it filled out? All 6 boxes are completed. Then it says the S-bar information is thoroughly identified and the chosen concept for the assignment is clearly identified. If you list your diagnosis, say, for example, where the concept map or the concept is listed right here in this box, if you put your diagnosis, asthma, in the main concept instead of inflammation, you lose those 2.5 points. Those are automatically done. Okay. Another what if. If, for example, and this is one thing that I've missed points on before, so your S-bar, situation, background, assessment, recommendations, right? say, for example, in your assessment, you say the patient is experiencing asthma exacerbation, possibly due to respiratory illness. What did I do wrong just now? I didn't say, I think. It's not a definitive diagnosis. We are not diagnosing the patient. So you have to put, I think. Um, I think that the patient is experiencing asthma exacerbation, possibly due to respiratory illness. There's a huge difference. It's like two words or one word, or the patient is possibly, how you list the way in this section, how you list it is so important. So make sure in this section that you say, I think the patient is experiencing blah, blah, blah. Okay. And then in the recommendation section, I would recommend starting a nebulizer. You don't just say start nebulizer treatments, blah, blah, blah. You have to say, I would recommend starting the nebulizer treatments or whatever the case may be. Okay. Just some examples of easily lost points. Okay. And that's 2.5 points. These are very heavily weighted. Your concept maps are heavily weighted. Okay. If you go back, I'm going to go to the home page for this course. Let's see. Where does it say? Oh, grades. Okay, disregard my grades. I'm not done yet. No, I think I have 100% right now in this class. I have not turned in my concept map yet, so we will see about that. On the side, you can see assignments are weighted by group, okay? Assignments, 0%. Coursework, SurePath, it's awesome to get 100% on all of your SurePaths. That gives you a 15%, okay, boost, okay? You have to work on those. But your DFC is 20%. Your skills videos are 15%. VCBCs are 15%. HESI is 35%. Your concept maps are part of, I believe it's DFC or ISB. I think it's DFC. Either way, they're very heavily weighted. So that's what I will say. They're heavily weighted. So make sure that you're going through the rubric for each concept map, and you're going through and you're seeing where you need to improve, what you need to do, go back and forth between the two. If you need to add something or change something, do that before you submit it. And then once you get to that point, you would do start assignment. You've saved it to your computer, so you would do upload files, choose file, and then you'll go to your files or whatever, enter it here, and then hit submit. Okay. So that is what you need to do for concept maps. I hope that was helpful. Please let me know if you need anything else, if you have any questions. I am not an expert. I don't claim to know everything, but I've learned from my own mistakes. And so I hope that helps a little bit. And good luck. Good luck with everything. I hope to hear from you. If not, have a great semester and flame forward.